Hello everyone, welcome to Raaonline. I'm Dr. Abhinaya, I'm a consultant pediatrician. So under the chapter discussion of neurology, the next topic of discussion will be approach to stroke. So this will be an overview of how do you approach when you get a child with a acute neurological deficit. So we will start. So first we will see what is the definition of stroke. Okay, so this definition is given by WHO. So they define stroke as it is a clinical syndrome of rapidly developing focal disturbance, or it can be a global disturbance of brain function. So and this disturbance can be either focal or it can be a global disturbance. The duration of this disturbance should last more than 24 hours. That is very, very important. If it is less than 24 hours, it is going to be a transient ischemic attack. Okay. Or if this rapidly developing disturbance of the brain can lead to death without any obvious non-vascular cause. So that is also comes under the stroke definition. So coming to the pediatric stroke, we know stroke can be either due to an ischemic event or due to a hemorrhagic event. Ischemic event predominates with around 60%, whereas hemorrhagic events comes around 40% as the causative for stroke. So stroke is nothing but whenever there is a sudden occlusion or rupture of the cerebral arteries or vein, which will result in cerebral ischemia. So that causes stroke. Incidence in children is not very common, 6 in 1 lakh children. But the mortality rate of stroke is very, very high. It is up to 5 to 10%. Whenever we receive a child with stroke, our aim is to identify where is the lesion. So depending on the neurological deficit, it is we can establish the pathology, or we can establish the site of the lesion in the neuroaxis. So it can be starting from the cortex, subcortex, anywhere the lesion can be present. So it can be in the cortex, it can be in the subcortex, it can be in the internal capsule, it can be in the brain stem, it can be in the cerebellum, spine, nerves, neuromuscular junction or muscle. So anywhere in the neuroaxis the pathology can be there. So before going on to approach to the stroke, some slides about the circulation we will see. This is just going to refresh your knowledge about the brain circulation. Not a very detailed one, but we all need to know this circulation. Okay. So the brain circulation is divided into anterior circulation and posterior circulation. Anterior circulation contributes to 80% of the brain's blood supply, whereas posterior circulation contributes only to about 20% of the blood supply. So the anterior circulation is by the internal carotid arteries, 2 internal carotid arteries from which MCA and ACA arises. So this contributes to 80%. Whereas the posterior circulation is from vertebral arteries, paired vertebral arteries, which joins together to form the basilar arteries and the posterior cerebral arteries. Okay. This is the pictorial representation of the circle of Willis, which I am sure everybody has learnt. So depending on the territory which is involved, depending on the ischemic territory, we will be able to identify which artery is the culprit here, which artery has occluded. So we will talk about the cerebral arteries first. So first comes the anterior cerebral artery. So we should know what is the territory which is supplied by anterior cerebral artery. So look at the image here. So the anterior cerebral artery is the territory is given in the red color here. So ACA supplies this medial part. Okay, medial part of the frontal lobe, medial part of the parietal lobe, and the anterior portion of the corpus callosum, some basal ganglia, and the anterior part of the internal capsule. So this is the territory of anterior cerebral artery. Middle cerebral artery is the major chunk. This is the yellow in the image. The representation, yellow representation is by middle cerebral artery. So the branches of MCA supplies the major part of the lateral surface of the cerebral hemisphere, except for the ones which is supplied by the anterior cerebral artery and the PCA. Okay. So maximum is supplied by middle cerebral artery.